Michael, it's great seeing you.
Good to
Thanks
see you
for coming
again.
back in. Everybody, we just wanted to give you a heads up on why Michael and I are having this conversation today. It's pretty exciting. He's a little bit past 12 months with your follow-up, your surgery. And it was funny, I was in the other day, I was in Austin, and I had stopped in to see Dr. McGrath, and we had seen each other walking by in the front area, and I was like, whoa, wait a second, no way. That's your result. And I was, of course, I expect this from all patients, but when I had to run back in and take a look at your before photos, man, that looks pretty darn good.
Yeah, I mean, it's like, you never know, right? You know, but to me, I wake up every day and I think this is just absolutely, I can't, I mean, there's no words. There's absolutely no words. I'm speechless.
Well, what's really awesome about it is, I had kind of been a student of hair. I mean, I'm walking around looking at people's heads for 37 years, right? So the first thing when I look at you walking through the lobby is, wait a second, is that a hair transplant?
Yeah.
And wait a second, Steve, you're in a clinic that does hair transplants.
Yeah.
So either you're a friend of somebody that works here or you've had a hair transplant. But once I looked at those before photos, it just blows my mind. And I think Dr. McGrath, I had checked your chart. I was like, whoa, what's going on? You had gotten on the medication, correct? So we did that for a little while, right? We had talked about exosomes. That was a decision that was going to be made kind of game time, which you decided to do.
Absolutely.
And then we had talked about, how many grafts we think we're going to put in that zone. I believe it was just over 2,000 grafts. Yeah. So you're one procedure. You've got dark hair on light skin. That's a challenge. Okay, it's just aesthetic challenge.
Yeah.
But what you did, and I congratulate you again, is you stepped up. You did the medicine. You did the exosomes. You've got that fantastic hair, and now you're out there walking on the wild side with a new head of hair.
Yeah, and I like the reference too. I love it. Yeah, it was interesting. I went to a Motley Crue concert years ago, and I said to myself, I want hair like Nikki Sixx. And literally right before this, I had 7-inch hair, and I was like, I'm gonna do it. But yeah, I cut it down just a little bit to kind of make it a little bit more manageable. But you're awesome. I appreciate all the recommendations. Just like you say, right? It's the preventative piece of it is huge, and the finasteride was a big piece, and I'm glad I got on it when I did, because like my dad and my uncle, I mean, their hair loss is absolutely like it's out there. But I got the courage. I went and saw you. You and I connected really well. Your story very similar to mine, and life has been nothing but positive after that. So
music to my ears. It's we're coming out with some goofy stuff. It's kind of interesting, and I know you're a YouTuber, so we talked about it. Yeah. But we want to do this thing where, if anybody remembers the movie Braveheart with Mel Gibson, where we talk about freedom, and the freedom from hair loss is going to kind of be the tagline. And when I look at you, and we had talked about your story originally, it's like this ongoing kind of reaction I get from most men. Women is a little different, but along the same lines, where life isn't exactly the same when you don't have styling options. When you were not a bald guy. I mean, you did not have a bald head. However, you were pretty deeply receded. Yeah. You couldn't have too many styling options.
Just one. That's all I had. It's that one style, and it rarely worked.
Yeah, and that's what I hear time and time again is the frustration. I know going back in the old days with me, was that I was just like, man, I don't want to have to shave this head. I just don't like the shaved head look. That was my personal, so that's why I started this journey. But the styling that you use now, and that's what caught my eye. This looks incredible. So again,
I swear I change my hairstyle every day.
That's awesome.
This is one of like many that I do, and I love it. I love waking up every day with options. It's like, I'm gonna do this side, I'm gonna do this side. I do a comb back at night. It's just life changing. I mean, it's just absolutely crazy to think, you got options now. Like before, it was everything goes down the middle, and then you kind of like cover up the receding hairline part. It was absolutely horrible. And
so,
without seeing you, I'm going to tell you.
Well, thank you for the kind words. And the psychology part of it, the preparation part of it, takes a lot of work. I mean, it's a lot of work because you've got to get over the hump. You've got to get over the resistance to maybe take a medication. You've got to get over the fact that these things aren't cheap. You know, hair transplants done the right way, hair restoration done the right way is not cheap. There's a lot that goes into it. And of course, by myself partnering with one of the top in the industry, Dr. McGrath, who did your work, I do talk to patients about other doctors as well throughout the country, throughout the world, that I have confidence on. But you can see, and what makes my day, and that's why I'm here today, and to hook up with you and talk about this, is that if you follow the guidelines, if you do things in the process of what it takes to prepare properly, that stigma attached to you where you're walking around with, where you're not liking the way you look, I mean, quite frankly, that kind of sucks.
It does.
So again, you are an example of success, of structure, of protocol, of customer service, of great surgery, and thank you for watching the videos, and now you're a part of them.
Yes.
And man, I gotta tell you, man, freedom.
That's right.
Cool.
Appreciate it.
Hey everybody, it's Dr. McGrath, and I'm here with my patient Michael. And Michael and I have been working together for a little over a year. We did his transplant about a year and a half ago. And what I'm really proud about with Mike's progression is that with many of our cases now, as I've talked about before, we added the ExaFlow exosomes to his treatment. We call it now XFlow. We're changing the nomenclature. But basically it's still working the same way. And what we've seen consistently, particularly when we use it in conjunction with surgery, is we tend to get faster growth, and even in one procedure we're seeing amazing results. Where a lot of times, and we told you this from the beginning, you know what, you're a 2-surgery guy because you have the dark hair and the light skin. But after one surgery, he's in heaven. He's in the happy land, you know. So we can comb through and look at where he's at, and when you see his pictures from before, you'll see that he had no hairline in here whatsoever. So we've been able to reproduce what is, I think, a very natural looking hairline. At some point we may come back through and add a little bit more density, but for one surgery with a little over 2,000 grafts, the patient has done beautifully, and I attribute that to just, you know, having good technique that we're using and staying consistent with our staff. But then I can't take anything away from, you know, our secret weapon, the ExaFlow, and it really has made a big difference. The grafts come in faster, they come in healthier, and we're seeing results like this each and every time, and it's just becoming mind-boggling. So I hope you're happy.
Indeed.
The hair looks fantastic.
Absolutely.
And you know, his smile says it all. So that makes it all worth it for me. And we're going to keep watching him and see how it progresses, and maybe after the next 6 months or a year we decide to come back and maybe add a little bit more density. But right now he's in the cat seat. He's happy, and everything's great. So you know, he's happy, I'm happy, and so that's how I look at it.
I love it.
You can't fake that. So it makes me very happy that we were able to provide that for him. So I think we've got a nice little secret weapon going here, and we're going to continue with it and continue to try to produce these, you know, world-class results. So I'm very happy for you, Mike.
Appreciate it, Dr. McGrath. Thank you so much.
I'm very happy for you. Okay.